One of the common questions that I get asked is, what is hyperparathyroidism? It can be broken up into three major categories. One is primary hyperparathyroidism. The next is secondary hyperparathyroidism, which also includes renal hyperparathyroidism, and then tertiary hyperparathyroidism. Primary and tertiary are very similar. They're treated the same way, and they behave very similarly. Secondary hyperparathyroidism is broken up into two major categories. One is renal, which is patients that have end-stage renal disease and end up with nodular hyperplasia of their parathyroid glands. Then the other category in there is more of the medical side, other drugs or body conditions that can cause the parathyroid level, or PTH, to be elevated when it is not in fact a surgical disease. So, primary hyperparathyroidism is a surgical disease. What happens? Well, in your neck, you have a voice box, you have a thyroid gland, and you have a windpipe. The thyroid gland is your metabolism gland. It regulates the RPMs on your car, how fast your engine's revving. Next to your thyroid, you have these four little glands called parathyroids, and those are the things that regulate our calcium. Now, they're really tiny. They're about the size of a lentil, maybe a few grains of rice. And we should have four, two on either side. And for the purposes of our discussion, we'll just talk about one bad parathyroid gland. Imagine your calcium in your blood goes up. You drank a glass of milk. Your parathyroid hormone level should shut off as a consequence of that. And when your calcium is elevated and your parathyroid hormone level is not suppressed, we know that you have hyperparathyroidism. Now, primary hyperparathyroidism is a surgical disease. So that requires a simple outpatient surgery to correct the condition in a matter of minutes. The easiest way to think about this is to think about a thermostat in your house. Imagine the temperature is set to 75 degrees. And inside the house, it's 80 degrees and the heat's still blowing. The problem is the thermostat is broken because it's not responding to the feedback from the high heat in the house. The simple thing to do is change out the thermostat and the temperature goes back to normal and the function of the house is back at its baseline. Same thing is true with the body. Once the bad parathyroid gland is removed, instantaneously the patient is cured of the condition and then the calcium will start to go back to normal. One of the interesting points about parathyroid surgery and hyperparathyroidism is that the parathyroid hormone only lasts about 3 to 5 minutes in your blood. So, in the operating room, after a bad parathyroid gland is removed, we can check your blood levels to see if you're cured. In about 5 minutes, that number should go down by about half. So if you start at 100, 5 minutes later it should be around 50. 5 more minutes it should be around 25. And usually it settles out somewhere in the teens. That's how we know if you've cured you. Your calcium does take approximately 24 to 36 hours to start to settle down, so you won't see the immediate effects until probably a day or two after surgery.